Good day, everyone. My name is Dr. Vishwendu Gaur. I am a MCH board certified plastic surgeon. I am practicing in the area of Delhi NCR. Welcome to Hexa Health. We are today going to discuss about the one of the very common procedures which I do in my setup, and I'm going to discuss it in this channel, is about the thigh liposuction. It's a very common procedure which is getting done. It forms a part of the total body contouring also, and some people get it done separately also for the better contouring of their thighs alone. Thigh liposuction is the process in which we remove fat, mostly from the lateral, which is the lateral aspect, or the medial, which is the inner aspect of the thigh. Mostly these are the two areas which we target to remove the fat. It decreases the bulk, the girth of the thigh. It gives you a leaner and a very fitter appearance of the thigh. It can be done combined with the circumferential removal of the fat, depending on how the results will be with that, or we can combine it with the liposuction of the lower back and the buttocks also. Thigh liposuction, people get it done, males and females both, they get it done it can be done separately also, or as a part of the body contouring procedures which we do. At times what happens is that with a bigger girth of the thighs, either due to hereditary or due to excess weight putting over a period of time, and with the lower back and the love handles also being bigger, and then we have the hip dips which are there, they go inside and they give your body a square short sort of appearance, which doesn't look good. And after a certain age, there's a very box type of appearance to the lower body and the waist. So we can augment the body contour to give it a better contour by doing liposuction on the lower back, doing liposuction on the thighs, and then augmenting the hip dip area. So giving you that hourglass figure which we all aspire for. Thigh liposuction, the benefits are that the contouring of the thigh takes place. The contour of the body, the lower waistline, the hips, the thighs, the symmetry and the shape of it improves, and you become more confident in wearing the dresses and flaunting your thighs as you go ahead. Incisions as such are very small. They are very small stab incisions, I think 5 mm or so. So incisions are not a very big worry. The site of the incision depends on the area which we want to target, whether it is the medial thigh, the lateral thigh, or circumferential thigh, area of kneecaps. But they are very small incisions. They generally come in areas where they are hidden very well, and they heal very good with time. So incision is not a big worry. If you are liking this video so far, then please subscribe and click the bell icon below. The results, somewhere around 2 weeks, you can start appreciating the results because of the edema starts. Almost half of it is gone by then. Around 80-90% of the edema is gone by first month. And that is a time where you can really appreciate the difference which this procedure has made to your thighs appearance. And almost all of the edema goes by 3 months. So this liposuction, whenever you get done, it's not a single surgery, it's a process. This process, the results of which keep improving with time, and with a good regime, as your doctor has ordered, with the pressure garments and everything, the results keep getting better with time, and optimum results can be attained with all the guidance. Generally, I advise my patients to take somewhere around 3 to 5 days break from their work, and with the wearing of the compression dressings initially and then compression garments, you can join your work within 5 days to 7 days. Some amount of edema is there which settles down by 2 weeks. So it is perfectly safe for somewhere around 5 days to 7 days when you can join your work. There are not many risks to thigh liposuction. One of the risks is when there is excessive amount of fat which we want to remove. We can discuss it with our plastic surgeon initially. So what will be a better procedure to do a thigh plasty where we remove some amount of skin and tailor the tissue according to your contour, or we only do thigh liposuction? That can be discussed prior. Some amount of edema, there may be chances that the fluid gets retained and some amount of fluid retention takes place. But other than that, with good post-op care and good compression garments, I don't feel edema or any other thing is much of a concern. It's not a very painful procedure. Post-operatively, analgesics are good enough to cover your pain, and then over a period of time the pain decreases. Pain is not pretty much. Bruising is there. Some amount of bruising does come, but then over a period of 10 days to 14 days, the bruising also goes off completely. So it is completely reversible and not a very big matter. What we do with thigh liposuction is we remove fat cells from the areas where we do the liposuction. So it decreases the number of cells of fat which are there, and thus it gives you the girth decreases, the bulk decreases, and that is how the thigh appears thinner. So yes, the results when we remove the fat cells are permanent. But it can happen that with the remaining fat cells which are there, with time, with no control over your diet, the remaining cells, they may increase in size and then they diminish our results over a period of time. But if you follow a good regimen, then the results are definitely permanent. Hope I have helped you to understand this topic of thigh liposuction better. For any further queries or any suggestions you have which you want to give us, you can write it in the comment section below, and please feel free to subscribe to Hexa Health for more information and informative videos, and don't forget to press the bell icon. Thank you.